You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey everyone, welcome to the Veterinary Rehabilitation Podcast. I'm your host, Dr. Megan Kelly. Today we're going to be chatting about a condition that can be so frustrating for us to treat. We've got Juliet Emery with us. She's a veterinary rehabilitation therapist, and she has a personal experience with degenerative myelopathy. Her golden retriever, Dixie, was diagnosed at the age of 12, and this led her on a quest for knowledge to find out everything she possibly could about the disease. So she decided to do her dissertation on degenerative myelopathy, and I've read through it, and she has really gone deep into this topic. So I thought it would be really great to get her online to chat about it. So welcome, Juliet. Thanks for coming on the podcast.
Thank you, Megan, for inviting me. I'm honoured to be here today.
So firstly, I just want to say well done on your extremely well-written and extremely well-researched dissertation. I know that Dixie was the reason that you did this, all this research. So well done on it. And I just wanted to, first of all, start off with just chatting about, maybe you can share some information about us, about Dixie, where she is, when you found out, and then we can just sort of go a little bit deeper into, the signs that you saw, how she was diagnosed. And I think that all this information can be so valuable for our vet rehab therapists, especially because you come from the side of being the owner and the vet rehab therapist in this case.
Yeah, okay, so Dixie's golden retriever, she's coming up to 13 years old this month, and she's doing quite well, I'm pleased to say. She's lying next to me. So I first noticed, she started becoming a little bit incontinent and then tripping on her back legs. She didn't fall over, but she kind of scuffed her feet and was a bit wobbly on the back end. So I took her to the vet and I asked for some advice about the incontinence to start with. And they said that it was probably an age-related issue. So they gave me some treatment for that, but it didn't go away with either of the hormonal treatments for incontinence. And I noticed that she started tripping a bit more. So I went back to the vet and they did some neurological tests, and that's when we realized there was a neurological deficit, and that was a year ago. So it all kind of started at that point.
And what was, the vet, was a disc or something like that? Was degenerative myelopathy the sort of initial diagnosis, or, often with these kind of cases, especially if it's not a German Shepherd. So obviously German Shepherds are the predominant breed that we see this condition in, but we do see it in other breeds too. So as a vet myself, it wouldn't have been top of the list in a golden retriever. I would think possibly there's a disc, maybe some lumbar stenosis or something like that.
Yeah, so it wasn't really on the radar to begin with. So my vet arranged for a number of imaging scans to be done. She had an MRI and a CT scan, which ended up being unremarkable. So while she was still under anaesthetic, he asked if he could take some cerebrospinal fluid as well to do some tests on that. So basically he did all the imaging scans and had blood test and CSF test, and they all came back pretty unremarkable. She's got severe arthritis, which I knew about anyway. No sign of any spinal injury or stenosis, but there were slightly elevated levels of protein in the CSF fluid that they took. So then he suggested to me that I do a DNA test because he had a suspicion that it might be something to do with a degenerative condition. So we went down that road next.
It's the buccal swab test, that swab where you put them on the inside of the mouth.
Yeah, so I ordered a kit from an online gene testing facility, and they sent a buccal swab, which obviously you can't see if the DNA's on there, but it is. So, but I sent it off, and I was it was only a couple of days later, actually. It was about a week after I had sent it, and they sent the results, and she actually does not have the genetic mutation. So she's normal for the genetic mutation. And I was ecstatic. I was like, well, this means that she doesn't have it. So I went back to the vet. I told him the results, sent them to him, and I went back to him. And he asked me to come in because by that time he had also the results, like he had some images of the scans that he wanted to show me. So we went back, and he had also sent the results to a specialist at Dick White's in Newmarket, a neuro specialist, and they both came to the conclusion that in the absence of anything else, regardless of the fact that she does not have the genetic mutation, that they still considered that she had degenerative myelopathy.
Oh, wow. So, I mean, I was under the impression that if you did that test, so there's 3 different options, right? You get the normal, and then you get the carrier, and then you get the high risk. So just so the listeners, this test is actually looking for a gene mutation and a specific gene called SOD1, and Juliet would probably be able to explain this a whole lot better than I will. And it's basically a mutation that they've found in degenerative myelopathy dogs, and that's where the link to the human condition ALS is. Is that right, Juliet?
Yeah, so the studies for the human condition, familial ALS, is where they discovered the point mutation in the superoxide dismutase gene. So this is an enzyme in the body that scavenges free radical oxygen and tries to basically remove inflammatory mediators. So they had discovered this gene mutation in humans, and obviously they then applied it to dogs. Now there are slightly different point mutations. I think they found 2 so far between different breeds. So I had asked the question that if Dixie was not carrier or was not at risk by having this point mutation, then surely she doesn't have it. And I was told that, you know, in some rare cases, there can be a spontaneous mutation somewhere else, which will have the same sort of effect on that enzyme, but not be able to be detected. And I'm not a geneticist, so I couldn't really go into that much detail.
Yeah, so I think that all cases have the SOD1 gene mutation. That's what I'm understanding. Listen, it's a condition that I think we're all trying to understand, and I think, you know, people are doing loads of research on it. And also, you know, when you look at humans and animals and medicine, not everyone does exactly what the textbook says. So it's always tricky. So okay, so she was negative for this mutation, yet she still has it. So how have her symptoms progressed now? Have they stabilized, or are they progressing?
So I think I can't say that she has it. She's been diagnosed with it, but this is the problem with degenerative myelopathy, is that there isn't a proper way to diagnose it at the moment. Since she's been diagnosed, I would say that she hasn't got any worse than she was when I first took her. And I don't know whether that's because I went to town on all the rehab, on the physio, on the diet, on everything to try and reduce the impact of how this would progress, or whether she doesn't actually have it. But I'm working on the premise that she does.
So if I look back to all the cases that I've treated, I would say 80 to 90% of them stabilized. So with treatment. So I never saw any of the ones that weren't coming to me. So as a rehab therapist. So I think that you can take it that everything that you've done has helped her to keep her condition as to where it is. And I've seen that in my cases. And it really is such a big commitment for the owner. And I see those owners that are committed and do things like you've suggested, change their diets, supplements, rehab, continue with exercises, some neural awareness type of exercises, you can really see that they stabilize and they maintain. So, obviously there is a progression now. So do you want to run through with us from, the research that you did, how they potentially can progress? And so, what is expected now to happen with Dixie over the next few years?
Okay, so there's 4 phases of the disease as far as I understand it. At the beginning, when there is a low load of inflammatory products within the spinal cord of the animal, the upper motor neuron is affected first, which means that they still have signals going to their muscles, but they don't use, there's like an ataxia, so they don't use their limbs properly. And it always starts in the hind. Obviously it goes from the back to the front usually. Might start in one leg or the other, but both will be affected. And as the symptoms progress forward, as there is an accumulation of inflammatory mediators within the spinal cord, degeneration will accelerate, and as more and more of the axons start to fail, be degraded, then it will start to affect her front limbs as well. And I think ultimately, when the upper and the lower motor neuron are both affected, then you have to decide with the welfare of your animal how they're doing mentally, dealing with whether they can or can't move. If they're tetraplegic, quadriplegic, or just have no ability to use their back end, if it's affecting their if it's affecting their breathing ability, their swallowing ability, I think you then have to make that decision. It's a lot about nursing towards the end of the disease, I think.
Now, personally, I've actually never seen them progress to having problems with breathing or unable to swallow. Have you personally ever seen that? I mean, usually I think the owner makes the decision to put them to sleep. In your experience, have you seen that before?
I haven't seen it, no. Obviously, I've joined a couple of groups on Facebook with people that have dogs with this problem, and some of them take them quite a long way into the disease before they make the decision, but that's entirely based on each individual owner and animal, really, how they're coping with that situation. If you've got a depressed dog who can't move and has a lot of bed sores, then yeah, you need to make a decision about that. But I've not actually come across any who, they get to the point where they can't swallow or they can't breathe, because that's effectively the end point.
Yeah, so earlier, before we started the interview, Juliet and I were chatting about, being an owner and being the rehab therapist. So we're very fortunate to be able to chat to Juliet about, the emotional aspect of that, because getting a diagnosis of degenerative myelopathy is one where you have no answers. First of all, you're not really sure whether that is what your dog has, so you question. And we've seen this in Juliet now. She's like, she doesn't know, because it is this diagnosis of exclusion. So, there isn't anything definitive that we can say yes. And we like to have answers. As people, we like to know what our dog has and how it's going to progress. And that's also something that is sort of out of our control, and we don't know how fast it's going to progress or how slow it's going to progress. So how have you handled that, Juliet, as an owner?
So before Dixie was diagnosed, I was having a bit of anticipatory grief about how old she was anyway. She's got quite severe arthritis in her tarsal joints, and she was getting old, she was getting incontinent, and I knew she was getting on a bit. So I was thinking about the end, which I understand to be anticipatory grief. When she was diagnosed with DM, I think that sort of went through the roof a little bit before I managed to gather myself a little bit, because I realized that the way that I was behaving and hugging her and crying and wishing that she wasn't going to get older. It wasn't making anything better, and it wasn't giving me any answers, and it was just going to ruin the time that I've got left with her anyway. So I think this diagnosis, where I can't reverse it or make it go away, sort of helped me get through that anticipatory grief of the end of her life, because I needed to work out what it was that was going to happen to her and what I could do, and basically be there for her and be like her and just live every day. So I think I get more of a sense of, having a better time with her while she's still around, rather than thinking about the end. And I can do that as a therapist. I can research this and I can treat her. So I've got an advantage over other people. So why not use that?
Yeah, I was going to say, for the general pet owner, it must be so difficult for them because they just don't have that knowledge, So you have the knowledge now to know that, and especially doing your dissertation, you know everything there is to know. So there's nothing more you can do. You're doing everything that you're doing. And I think that we must just be aware with our clients that they don't have the benefit of all that knowledge, and you must just be aware that it's difficult for them. I mean, as a owner of a dog with degenerative myelopathy, what advice would you give to rehab therapists in how they communicate and the suggestions that they give to pet owners about handling the condition, and when maybe they might be thinking it might be coming to the end of their pet's time, when those symptoms progress?
I think if you are a practitioner for somebody who has an animal and doesn't have the knowledge that you have, you really need to try and understand the emotional impact on them. I think they probably, you need to try and get compliance, but you also need to have some understanding that they might be sort of resisting this diagnosis a little bit and pretending that it hasn't happened, because I did that a little bit. I would sit there and go, I could do some physio with her now, but she's asleep and she looks comfortable, and I'll just leave her. I think you have to be aware that an owner might have some trouble, first of all, accepting the diagnosis, and then when they've accepted it, then they're going to start getting upset about it. And I think as long as you can remain positive and show them that, explain to them why you're giving them the exercises you're giving them, or why you're making the suggestions that you're making, and how it's going to help them physically, and then they can see that if they do that, then the dog is happier, then I think that helps them a lot. But also, they have to have an acute awareness of how they think their dog is feeling versus how they are feeling about the situation. So, as you get towards the end, it is going to be extremely difficult. And I think, you might have to point out to them the things that they might not want to see.
Yeah, I think that's great advice. Just always remain positive, because it's sometimes can be a short road, but sometimes it's a long road, and they need that positivity in their lives to also spread that to their pets, because when they're positive, they're often happier too. So.
Because it's hard work for them as well. If you have a big dog, and you need to support the dog because it can't use its back legs properly, or needs support going to the toilet or something, it impacts them physically as well as mentally as well.
Yeah. Juliet, have you looked, have you seen recently, I actually read an article about some research that they're doing on ALS. It's actually research that they're doing for people in treating ALS. But they actually are doing it on this a study that's done on 4 dogs at the moment. I don't know if you're aware of it. They were looking at injecting adenovirus into the CSF space, and it basically puts DNA particles that can bypass the blood-brain barrier, and these particles basically silence this SOD1 mutation. So there wasn't a lot of information about it, but it was quite interesting, and they're basically just doing it on 4 dogs at the moment and started to see some improvements in them. So it's interesting research, and I think a lot of the research it's quite nice that there is this connection, because there's often a lot more funding into research for conditions that humans have, but it's one that is going to really benefit us in our degenerative myelopathy cases.
Yeah, no, I hadn't heard of that before. You mentioned it before the interview. That is quite an interesting study that they're doing. You know, if you can either repair or bypass the mutation to stop the enzyme becoming, you know, it's misfolded, therefore it doesn't work properly. If you can bypass the mutation and make the body make the enzyme properly, then you can reverse the condition. Or, yeah, I mean, this is the good thing about the fact, as you said, that it is very closely related to familial amyotrophic lateral sclerosis in humans, because human diseases get a lot more funding than animal diseases, but because they are so closely related, it's easy to then transfer any findings that you have in the human side over to the animal side, and I think that can only benefit the situation.
Yeah, and they're using the dogs now as the animals that they're treating to test to see whether it'll work in the humans. So I think that they did the same study on mice before, and then now they've moved on to the dogs. So, Juliet, I'd love to hear, you know, what you're doing with regards to nutrition and supplements, because over the years I've read loads of different articles on different things that is a suggestion for degenerative myelopathy cases. So let us know what you're doing, and maybe there's some recommendations in there for vet rehab therapists to pass on over to their pet owners.
Okay, well, a lot of people like to feed fresh, raw food when they have a dog with this condition. What you want to try and do is minimize anything going into the body that might cause inflammation, anything that might have toxic byproducts. You want to give good, clean, fresh food. I do still feed my dog kibble, but I give her a good quality kibble. But what I add to that is a number of antioxidants. So she has the dog multivitamin, and that includes a lot of B vitamins, which are beneficial for nerve conduction, nerve health. I also give her it's a mushroom powder, and that's got a lot of antioxidants in it. So she gets that with her food as well as, you know, other things that can benefit a dog of her age. So joint supplements, and, you know, oily fishes and omega-3 and all those foods that are good for an aging pet. I wouldn't say I'd done anything, you know, along the lines of having a specific diet, but I have added these supplements, which, you know, they seem to be helping.
And I think the antioxidants are significant, you know, considering, you know, the findings of this SOD1 gene mutation. So antioxidants I think are important, and I always recommend to my patients to give a multivitamin and also some form of antioxidant supplement. I wanted to chat to you about the physio side. So, you know, what is Dixie doing every week? I know that you have been doing hydrotherapy with her for about 10 years now. So I'm guessing that she has some concurrent arthritis, or she's been diagnosed in a young age. So she must have been about 2 when you started that with something else. So can you just go through that a little bit for us?
Sure. So Dixie was actually diagnosed at 8 months with osteochondritis dissecans in her right hock. I decided against having, well, they suggested obviously I couldn't have any kind of surgical intervention until she had finished growing, given she was only 8 months old. But I wasn't sure I wanted to go down that route anyway. And I just happened to meet this lady at a local dog show, and she was a recently qualified hydrotherapist, and I didn't know anything about hydrotherapy at all at the time. And I said hi to her and told her about my dog's problem, and she said, get a referral and come and try hydrotherapy. I think it will really benefit. And we didn't stop. We've never stopped going, because the benefits to her, now that she has very severe arthritis in both of her hocks, and now with the degenerative myelopathy and probably a lot of arthritis and other joints in her body, we go swimming every 2 weeks, and I think that makes a huge difference. I think it also helps, dogs that might have degenerative myelopathy from a mental perspective as well as a physical perspective, because it must be so frustrating not for them to be able to do dog things, move around properly, defend themselves, clean themselves. And the hydrotherapy is good for, muscle health, for joint health, but also for mental health. So yeah, we'll keep going.
So in my practice, I only had an underwater treadmill, so I didn't actually have a pool. And I used to find that exact thing with those patients. I mean, just they loved going in the underwater treadmill. And the one thing that I found amazing, and it depended on sort of how severe their symptoms were, but some of them were not able to ambulate well on land, so there was severe proprioceptive deficits. But you put them into the underwater treadmill, and I mean, they didn't walk normally, but they had no proprioceptive deficits. They were actually able to walk. And I remember the owners used to just be completely amazed about that. And so I found the underwater treadmill a great form of hydrotherapy for degenerative myelopathy, and also for that neuro re-education. But if you're doing other physio with them, you can still get sort of that proprioceptive input, doing other physio treatments. So what is the commitment from your side as the owner and the rehab therapist? What are you doing? Because I must say, I've got a dog with hip dysplasia, and I'm one of those type of owners that could be doing a whole lot more because of my knowledge, and I think that doctors have the same thing, with their families and their health, and we're really good at treating other patients, but not as good as treating our own. But maybe you're different. I do a lot for my dog, but I sometimes say to myself, I could do a whole lot more, So what are you doing?
Yeah, so I think I'm a bit like you. I referred to that, even though I have the knowledge, you have to have owner compliance, even if you're the therapist, in order to achieve your outcome. Yes, she does the swimming, and I've got a class 3B laser, so I use that on her once a week. We definitely do exercises. I wouldn't say I do a defined regime of exercises, but I do incorporate them into the 2 shortish walks we do a day, and when we're in the garden before she eats, she's got to do sits and stands, and various different aspects of what would be an exercise routine throughout the course of the day. Because I find, if I try to do too much in one day, you can easily fatigue a dog of this age with this condition, and then that doesn't benefit them at all. So it's a little bit cheating, but I do still do physio with her, but just sort of incorporate it into the day rather than having and she gets a good old massage a couple of evenings a week. So
yeah, listen, I'm sure that she gets loads and loads and loads of special treatment from you, and she's very lucky to have you as an owner with all this knowledge. Thank you so much, Juliet. It's been wonderful chatting to you, and yeah, I look forward to hearing about Dixie and your journey, and please do keep us updated on how things are going with her. And thank you very much for taking the time to come and chat to me.
Well, thank you for inviting me, and I appreciate that you read my dissertation and thought so highly of it. So I will keep in touch and let you know how we get on.
Great. Have an awesome day, Juliet. Take care.
Thank you. Bye.
Vet Rehabbers, thanks for listening to my podcast. Don't forget to click the subscribe button, and it would be great if you could leave me a review. I want to know, what are you doing on the 15th to the 17th of November? It is our Vet Rehab Summit, which is our online virtual conference for veterinary rehab professionals. Find out more information at onlinepethealth.com.